Hello, ladies and gentlemen. We are from Team Medical Physics 3. First of all, we would like to say thank you for being here with us today. Since December 2019, humanity is once again facing a pandemic, this time caused by a beta coronavirus or the SARS-CoV-2. The disease caused by this infection was named Coronavirus Disease 2019 or COVID-19. For confirming severe acute respiratory syndrome coronavirus 2 infection, which is the cause of COVID-19, real-time reverse transcription polymerase chain reaction or is known as RT-PCR is regarded as the gold standard. However, in medical physics, we know a special equipment to diagnose a disease as RT-PCR. It is a chest CT scan. Based on data, chest CT scan has an ability more powerful than RT-PCR. What we want to share with you is Radiology Diagnostic. Is it work to diagnose coronavirus? So, before we start, let me introduce you to my teammates. There is Fikri, Riyadi, Ulhaq, and Lasminar Marpaung. And there is Ridho Mahendra and Dewi Sekar. And also there is Galih Saputro and me, Vivia Karen. And this is the list of content we will talk about. Jump to the first content. What is medical physics? Medical physics is a unique workforce characterized by a large variety of relatively complex tasks. Medical physics is typically the smallest of the professional groups with the least redundancy built in and often the smallest of space. Example: radiation safety monitoring, teaching, education, and research.
What is radiology, and is it useful for the future? So, radiology is a crucial component of medicine that is of major importance to medical practitioners, healthcare workers, and health policy makers. Radiology includes diagnostic imaging and image-guided intervention procedures, which could replace many sophisticated surgical interventions, thus reducing patient stay at hospital, hazard of general anesthesia, and all post-operative possible complication. Radiology diagnostic has a good development. Artificial intelligence algorithms, particularly deep learning, have demonstrated remarkable progress in image recognition tasks. Historically, in radiology practice, trained physicians visually assessed medical image for the detection, characterization, and monitoring of diseases. AI methods excel at automatically recognizing complex patterns in imaging data and providing quantitative rather than qualitative assessment of radiographic characteristics. There are several types of radiological examination that are commonly used. The first one is computed tomography or CT. Conventional tomography is created by simultaneously moving the X-ray source and X-ray detector in tandem, so as to keep an object of interest in the center point of the scan plane and blur out all other objects. Computed tomography is one of the most important medical innovations in human history. Images display soft tissue contrasted with anatomic detail, facilitating unprecedented diagnostic accuracy. The second one is X-ray. There are two broad categories for medical imaging by X-ray: structural imaging, which reveal anatomical structure, and functional imaging that measure changes in biological function, including metabolism, blood flow, regional chemical composition, and biochemical processes. X-ray are widely used in structural imaging of bone, teeth, microcalcination, lungs, and orthopedic devices. The third one is fluoroscopy. Most fluoroscopy procedures involve introduction of contrast medium through injection or infusion into the respective body part in order to identify existing congenital, acquired structural abnormalities, or to assess organ functionality. And the fourth one is ultrasound. Ultrasound uses high-frequency sound waves above the range of human hearing, which are transmitted into the body. The echoes reflected are mapped into an image based on the amplitude and time delay of the returned signals. Ultrasound elastography, a relatively new technique, provides semi-quantitative and quantitative measurement of tissue stiffness.
What's coronavirus? Coronaviruses are a large family of viruses transmitting between animals and people that cause illness, ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome and severe acute respiratory syndrome. Reports suggest that 2019 novel coronavirus infection can cause mild to severe disease and be fatal in some. Common observed symptoms include fever, cough, shortness of breath, and breathing difficulties. In more severe cases, infection can cause pneumonia or severe acute respiratory syndrome, particularly in those with other chronic underlying health conditions and even death. Search World Health Organization edu. Coronavirus detected. Since December 2019, a number of cases of unknown viral pneumonia related to a local seafood wholesale market have been reported in Wuhan City, Hubei Province, China. Based on data, Indonesia has a coronavirus cases 623,309, deaths 18,956, and has been recovered 510,957. RT-PCR is regarded as the gold standard for testing coronavirus. Search World Health Organization.
Advantages radiology in pandemic virus. Medical imaging plays an important role in supporting clinical decisions making in the diagnosis, management, and treatment of COVID-19 patients. Medical imaging may be useful for differential diagnosis between COVID-19 and other viral respiratory illness diseases with similar symptoms. Chest radiographs, chest CT, lung ultrasounds, as well as MRI are included in the arsenal of medical imaging, each one with advantages and limitations. Chest radiographs, CXR, are the most widely used imaging modality for suspected and confirmed COVID-19 cases. Mobile radiographs are being used with increasing frequency to avoid possible transmissions during patient transfer to imaging departments, as well as their traditional role in imaging critically unwell patients. Chest computed tomography (chest CT) has a limited but important role in clinical management of COVID-19 patients. CT should be reserved for seriously ill patients, with emerging awareness of high prevalence of pulmonary thrombosis. In addition, it can be used in the case of inconclusive chest radiographs or unavailability of PCR tests.
Okay, next is how does CT scan work? Unlike a conventional X-ray, a CT scanner uses a motorized X-ray source that rotates around the circular opening of a tunnel-shaped structure called a chantry. During a CT scan, the patient lays on a bed that slowly moves through a country, while an X-ray tube rotates around the patient, shooting narrow beams of X-ray through the body. Instead of film, CT scanner or radiologists use a special digital X-ray detector, which are located directly opposite the X-ray source. As the X-ray leaves the patient, they are picked up by the detector and transmitted to a computer. Okay, next the picture. Each time the X-ray source complete on one full rotation, the CT computer use a sophisticated mathematical technique to control a 2D image slice of the patient. The thickness of the tissues represented in each image slice can vary depending on the CT machine used, but usually range from 1 until 10 millimeters. When full slice is completed, the image is stored, and the motorized bed is moved forward incrementally into the gantry. The X-ray scanning process is then repeated to produce another image slice.
This process continues until the desired number of slides is collected. So, after we go to the next picture, image slides can either be displayed individually or stacked together by the computer to generate a 3D image of the patient that shows the skeleton, organs, and tissues as well as any abnormalities the physician is trying to identify. So, for coronavirus identify, radiologists or the physician use a test area to diagnose. So this method has many advantages, including the ability to rotate the 3D image in space or to view slices in succession, making it easier to find the exact place where a problem may be located.
In this slide is about test CT scan effectiveness. According to AI et al. 2020, test CT scan has a high sensitivity for diagnosing of COVID-19. Test CT scan may be considered as a primary tool for the current COVID-19 detection in epidemic area. But is it true that the diagnostic value of CT scan is better than PCR for diagnosing COVID-19? Thus, the discussion of research conducted by researchers from China, which conclude the diagnostic value of CT scan is better than PCR. Let's take a close look at the research so that we don't get the wrong conclusion. The research team compared the result of a CT scan with PCR patient with suspected COVID-19. In this study, CT scan was the index and PCR was the reference. If the assumption is CT scan as index and PCR as the reference, whatever the result of the study, we certainly should not conclude that the diagnostic value of CT scan is better than PCR. Why cannot? Because until whenever the index will not be better than reference. What if we want to find out whether CT scan or PCR has the better diagnostic value? The question is fine, but we have to make a new assumption. The first assumption is that PCR not a reference but an index. The second assumption is that we have to present new reference. Apparently, the research team carried out the analysis. The PCR was used as an index, so the first assumption was fulfilled. The clinical judgment is used as a reference. The second assumption is met. Finally, the researchers compared the diagnostic value, the sensitivity and specificity of PCR with CT scan were obtained. The result is the clinical judgment of probable and uncertain case is considered not COVID. Then the sensitivity and specificity obtained are as PCR 80% and 100%, CT scan 97% and 82%. If the clinical judgment is probable and uncertain case is considered COVID, its sensitivity and specificity are PCR 66% and 100%, CT scan 98% and 100%. The researchers conclude that the CT scan has better diagnostic value than PCR. So it can be concluded that the better diagnosis is that when we put the PCR as a reference, CT scan will not be better than PCR. If clinical judgment is approved as a reference and PCR and CT scan are both indexes, so based on this research, CT scan is better than PCR. In this slide, we know that of 1,014 patient COVID, sensitivity of PCR is 88%, then CT scan is 97%. Okay, the conclusion. Coronavirus is a dangerous disease, but it can be detected by a gold standard RT-PCR. However, in medical physics, we know a special equipment to diagnose a disease as RT-PCR. It is a test CT scan. Based on data, test CT scan has an ability more powerful than a gold standard RT-PCR. By a good management, radiologists can diagnose the patient with high accuracy and it's useful to treat the patient. Even though test CT scan has a lag, this equipment does not distribute well. That makes it hard for people when they live at countryside with a minimum accessibility. These are some of the sources we use. Thank you for your attention. I hope you enjoy it.